Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take action to try and make a better system for all of us. We have a bunch of topics, some allergy related, some Medicaid related, but before we get to them, down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter that has a ton of references and background material and links to medical studies, and you can, of course, subscribe for free. And get it delivered to your inbox almost every day. Okay, let's get started. The FDA is moving, the U.S. Food and Drug Administration is moving to phase out the leading decongestant found in hundreds of over-the-counter medicines, concluding, based on studies, that it doesn't actually relieve nasal congestion. Phenylephrine is used in popular versions of Sudafed, Dayquil, and lots of other medicines. Experts have long questioned how effective it was. Last month, the FDA formally proposed revoking its use in pills and liquid solutions, kicking off a process that's likely to force drug makers to reformulate. It turns out that phenylephrine is actually a good medicine, but not when you swallow it. The stomach breaks it down way too quickly to make it effective. Now, there are other medications that do work. Pseudoephedrine is often suitable. Medicines that contain it are usually held behind the counter at drugstores or discount places because you can make methamphetamine if you get too much pseudoephedrine in your hands. So they kind of limit the sale to a reasonable amount. Beyond those, you can use nasal sprays or saline rinses to help clear mucus from the nose. Doctors often recommend nasal spray steroids like Flonase, Nasacort, and Rhinocort. They work pretty well. I use one of those. My doctor says don't use something like Afrin, though. The reason is that Afrin, while it works super well for 2 or 3 days, if you stop using it after 2 or 3 days, you'll actually have a rebound and you'll wind up more congested than you were to begin with. Word to the wise. Let me talk about a study that was done in Canada on severe allergic reactions. A new study of severe allergic reactions was just published from McGill University, and there's a link to their research report in the newsletter. The study found patterns between the triggers and symptoms of anaphylaxis, which is good. Now, that's an allergic reaction that can be fatal within minutes if it's untreated. Food was found to be the most common trigger, responsible for over half the cases they looked at, and they looked at about 1,100 people. Among these, tree nuts stood out for their strong link to throat tightness compared to other allergens. Reactions from the venom of insect stings were more likely to trigger heart-related problems like a decrease in blood pressure. Anaphylaxis is most often caused by food, bug bites, or medication. While doctors often treat it effectively with epinephrine, the authors say the doctors rarely understood why certain triggers cause specific symptoms. Now, that knowledge gap can delay diagnosis and appropriate treatment. One of the things I found really interesting was that if you have a tree nut allergy, the symptoms of the allergy were going to be way worse if you were drinking alcohol while you were eating nuts. So again, word to the wise. Let's talk about Medicaid because there are changes coming in the Trump administration. Among the health policy changes likely to be implemented is the ability for states to demand that Medicaid recipients work. Now, adding work requirements to Medicaid would cut federal health spending a little bit, not very much. And this is at a time when Republicans are going to be scrambling to pay for tax cuts that they want to give to the wealthy. On the surface, the idea of promoting work is popular, even though the one thing Medicaid work requirements don't deliver is, well, work. They don't actually encourage people to go to work, and I'll talk more about that. If work requirements, though, are not added to Medicaid through legislation, they almost certainly will be pursued by individual red states through Medicaid waivers, which were implemented at the end of the last Trump administration. You can find a link to the Kaiser Family Foundation report on this. Now, the Congressional Budget Office recently analyzed what would happen if we had Medicaid work requirements. It was published about a week ago in December 2024. They found, their estimate, at least 600,000 people will lose health insurance. In fact, though, it will likely be more because the CBO had an assumption in their model that the states would pick up the cost for many of the people who would be dropped if there were a federal work requirement. It's not likely that Republican states are going to do that. That's just not going to happen. So it's more likely to be closer to 1.5 million or more people. Anyway, a work requirement for Medicaid will not push people into the workforce. This is because most Medicaid beneficiaries are already working, or they're exempt for other reasons, like they're caring for a chronically ill family member, or they're in school, things like that. Though those people are typically in jobs that don't provide health benefits. Many low-income people are in low-wage jobs without health insurance. Of course, when you take away their health care and they become ill, they'll fall out of the workforce entirely. I have a link to a Commonwealth Fund analysis of the Georgia and Arkansas implementations of Medicaid work requirements. In a single word, fail. Most of what these programs do is force beneficiaries to go through a lot of red tape to prove that they're working or exempt. When some don't or can't, or the software they're supposed to implement, they're supposed to upload their information to doesn't work, or they're not even aware of the requirement to record their information online, they just drop off the rolls. Not everybody who is poor has access to the internet to do this. Anyway, it's a backhanded way, it really is a slap in the face way to cut Medicaid eligibility, much more than a way to promote work, because this is just a cruel policy that they're putting forward. I have a link to a Kaiser Family Foundation report on the Medicaid work requirements, and you can see essentially it just doesn't work. People do not go to work. I can tell you off the cuff, this is away from the text, when Georgia implemented this, they spent tens of millions of dollars getting the system up and running. And if they would have expanded Medicaid, it wouldn't have cost them any more money, and they would have had insurance for 250,000 more people. So they didn't expand the income level, they implemented the Medicaid work requirement, and guess how many people went to work and got Medicaid? 5,000. Okay, nice, very nice. Recap, after a work requirement to have Medicaid health insurance, adding a work requirement to Medicaid health insurance to demand, let's try again. Adding a work requirement to have Medicaid health insurance does not increase the size of the workforce because most poor people that can work are working or they're exempt. Because of this and the added expense of implementing a system to track it, the cost to the states will actually rise significantly. Many hundreds of thousands will lose health care, if not millions, and there's no way to replace it because of the cost of private policies. They can't go out and buy an ACA policy because they don't have the money. That's why they were on Medicaid. Thus, this policy will cause harm, it will cost more, and it will not put people into the workforce. We have evidence from states that have tried it. It doesn't work. Let's let our elected representatives know. P.S. When people do have health insurance, it does allow them to go to work. So that's really the way. If we had universal health care, guess what? It would be easy for them to go to work if they weren't working already, and they wouldn't have to worry about it. Okay, let's contact our member of Congress and senators, let them know that Medicaid work requirements are a failure waiting to happen. I have a link where you can reach them, or on your cell phone, you can send a text message to 50409, sign space, SIGN space, PNZNNL, sign PNZNNL, that's ResistBot, and it will, if you haven't used it before, it'll ask for your name, address, phone number, email to make sure it gets the right representatives. Here's what you'll tell them. Just what I told you. I'm your constituent, and I understand that the new administration wants to allow states to implement work requirements for Medicaid. The Commonwealth Foundation and the Kaiser Family Foundation have both analyzed the states that tried it and found that it does not put people to work, costs states more, and it is ineffective. Pretty much everyone who can work is working, but many of those low-wage jobs do not include health insurance. When you take away the insurance and those people become sick, they are then unable to work, and you decrease the workforce. The Congressional Budget Office estimates that hundreds of thousands will lose their health insurance this way. What is needed is universal health insurance, not a fake bureaucratic program to deny insurance and waste money. I want you to remember that when people have health insurance, it's easier for them to work and stay at work. When they lose health insurance and become ill, they lose that opportunity to work. Do not allow the states to implement a work requirement for Medicaid. This is a backhanded way to keep poor people from having health insurance rather than a way to get people to work. Of course, the best answer is universal health insurance that costs less, covers everyone, and like our 35 industrialized peer nations, we would have it too. We could do that. It's up to you. Thank you. I include at the bottom of the email all of the analyses so that the legislative analysts can take a look at it. That's what I've got for you today. I know today was a little long. Down below, like, share, and subscribe. Send me comments here or at healthcareadvocacy1@gmail.com.